So we have all seen the issue that we're having with healthcare, right? I already read Florida apparently leads a nation with people who have dropped out of health insurance coverage. We have these issues with the extensions, and Congress and the White House is trying to figure out what steps to take. The problem is insurance keeps going up. And so the number one reason actually people file for bankruptcy is because of insurance or health related issues. Now, if you don't have insurance and you end up going to the hospital, guess what? You got a bigger problem now because now you're definitely going to file for bankruptcy. Just think about the cost of one overnight stay. I'm tired of having clients who've had to file for bankruptcy. They don't have insurance, but when they go, if it's a car accident, at least in Florida, we have that $10,000 policy. And one day, that policy is gone. They've used up all the funds on that. So if it's $10,000 a day, I don't know, but the insurance, the hospital is going to come up with a way to bill you $10,000 and then throw you out the door. That is the sad reality of our healthcare system. But hey, it's a for-profit system, so these are the consequences. That's why I just look at for-profit jails and how that went out, how that went. Now, here's the problem. Suppose you don't have insurance or you have minimal insurance or you just cancel insurance. I don't care what the problem is. I don't even care if you have insurance because remember, insurance chances are it's not going to cover everything. Might be 80-20 where you're responsible for 20%. 20% after a week is a lot of money. Here's the problem. I wrote a blog about this before. I just recently updated and I'll put it in the description below, but it's hospital billing tactics. The problem is when they ask you for ID and you say, oh, here's my license. They say, we need more ID. I said, who carries their social security? I don't have that. So luckily for me, I have like my bar card. So maybe I can give them that. That's official, right? It has my name on it. You can check on the Florida Bar website. This guy's legit. But for those who don't have an extra, form of identification, what do you think the hospital is going to say? Well, just give us a bank card, debit card, or credit card. That way we can make sure everything matches. Why? I just gave you my license. That's good enough, right? And if there's just insurance, it really shouldn't be an issue. Just match everything up. We're good to go. Get my social security number. You confirm it with the insurance company, and this conversation is done. But it's not. A lot of times they will ask for your debit card. They're going to ask for your credit card. And why? Because they actually swipe it. I'm tired of reading stories. It happened to me years ago with clients. And I'm not going to say it was just one section of Miami because I've heard this in other locations. I've seen people posting on social media, etc. So it's not just Miami, it's everywhere else. Where the hospital will run your debit card. Now, suppose you have money in that bank account, you got 5 grand, all that money's gone once they swipe it. How are you going to pay for your mortgage next week or next month or whenever it is that's due? All your money is gone. Now, suppose you give them a credit card. All of a sudden, you went from bankruptcy is not even remotely an idea that has ever crossed my mind, but all of a sudden you have a credit card with a large line of credit. They swipe it, 10, 15, $20,000, and all of a sudden you're 15 in the hole. I have one credit card that has $15,000 credit card limit. So imagine if that's down to nothing. Let's say it's down to $1,000, and all of a sudden they swipe it and they're able to add 10, 12, 13, 14 to it. Now you could always work out a payment plan with the insurance company, but there's no payment plan once that money's all been taken out of your account or added to your credit card. That's a big hit. $10,000, $12,000 in one shot is going to hurt just about everybody. Unlike a payment plan, hey, I'll give you a couple $100 a month until you can figure this out. So what I've always told people is if you go to the hospital and they're asking for all this extra identification, such as your bank card or your credit card, I just simply, my advice to you is don't have it. Left at home, don't have one, whatever you want to say. But understand that once you give it to them, now you have the problem where they could do it. Now, could you dispute that? Sure. But here's my question. Did you receive the services? Because I've been in the issue where it's been fraud on my account. And I'm like, I didn't receive the services. Once I had a golf course, I remember, they charged me for all these, it was a spa treatment. And I go, I was there at the hotel by myself. I didn't go to the spa, but somehow, I guess someone who works there gave that information and it was quite a few bucks. And it took like 6 months for me to get my money back. So, imagine I didn't get the services then. So you would think the money came in much quicker. But what about when you do the services, when you receive those services? Say, well, you had a broken finger, yeah? Okay, then so they billed you for it. That's not our problem. You're saying that you didn't have your permission, all that. Bank's gonna say it's not my problem. You can go ahead and file a lawsuit against you. And here's my question now: you're really gonna go against the hospital and their team of lawyers? It's probably not going to work out. So the easiest solution is just simply don't give them your bank card or your credit card. They don't need it. They need to confirm your identity, driver's license, social security, that they'll match up. When you fill out the forms when you go to the hospital, you'll fill it out. They'll get that information. They'll contact the insurance company and they'll be able to confirm. But the second you give them access to your money, that money's gone. All right. Any questions or comments, feel free to post them in the comment section below. If it's happened to you, please, by all means, put that in the comment section. I would love to hear from you. All right. Take care, everybody, and have a good rest of your day.